Welcome back. Well, it's time for some girl talk. My favorite segment. Dr. John Adams with Institute for Women's Health is here to walk us through all 9 months of pregnancy, 40 whole weeks, the good, the bad, and the ugly, right?
Right. I hope.
Good morning, Dr. Adams. How are you?
Good morning. I'm fine. Thank you.
You know, for women who have never gone through this before, maybe we've got some women watching that just found out they're pregnant. You know, Javier's wife, she just found out they're pregnant with number 5. Let's go through the different trimesters and exactly what's going to happen. Can we do that?
Sure.
Some details here. So the first trimester, what are the signs and symptoms that you are pregnant?
Well, I think that it varies between pregnancies and between women in general, but I think the most significant sign or symptom that you're pregnant is that you missed your period or it's delayed.
Okay.
And then shortly after that, within a few weeks usually, and this varies too, nausea, pregnancy, the dreaded morning sickness can happen. Fatigue.
Fatigue, yeah. That was very common with me. I was so tired, and I was like, what is wrong with me? And then, of course,
right.
Surprise! What about, what kind of tests will you be doing and going through when you first find out you're pregnant?
Well, we always want you to come in as soon as we know that you're pregnant so that we can do some proper counseling, let you know about the tests that are available. Some are pretty basic tests, like wanting to know your blood type, wanting to know, basic things like, HIV status, whether you're anemic or not. And then we also talk to you about some optional tests, and those usually include like genetic testing or chromosomal abnormality testing.
And I guess some of that would depend on your age, right? The woman's age?
Yes, it does. We do offer testing to all patients, whether they're on the younger spectrum or whether they're over 35. But you're right, it does matter. It does affect how we counsel them. What
about, let's say someone takes a pregnancy test at home and they're just pregnant. How soon do they need to come and see their obstetrician gynecologist?
Well, I think certainly if they're having any concerns with bleeding or pain, if they're not feeling well, then they should come in sooner. If they're feeling well, if they feel like things are going pretty well for them and they found out they're pregnant, then I think when they can call and get an appointment scheduled, we have staff there that are trained to offer them appointments at certain dates.
And they know
the better.
When they need to come in, they can let them
Exactly.
know. Okay, so the first trimester, baby's tiny. How big does the actual baby get in the first trimester? Like if you had to compare it to a food, would it be the size of a peanut? You know, what size would it be?
I think that's probably an accurate description in the very early first trimester, probably about the size of a peanut, and then from there it just grows into your larger nuts and then fruits.
and then into fruits and then into a baby. Okay, let's talk second trimester. So we're through the first 3 months, which is also kind of can be the dangerous zone, right? Dangerous period, maybe, for miscarriages?
I think if that's going to happen, if that were to happen, then the highest risk time is going to be usually during the first trimester and usually during the early part of the first trimester. Okay,
so we're into our second trimester. What's happening with our bodies? What changes are happening?
Well, a lot of things. Physiologically, there's a lot of things going on. The fatigue, unfortunately, continues. Weight gain sometimes will start to pick up after you get through the first trimester. It's not surprising to lose a little bit of weight in the early part of pregnancy. But
that never happened to me. The scale never went down, unfortunately.
Right. And then, of course, breast tenderness and then growth of the baby. Most of the organ systems have formed by that time, and now it's a matter of growth.
The organ systems have formed by the second trimester. That's amazing. What about emotional changes? Are the hormones kicking in? Are you feeling a little, maybe not quite like yourself at that point?
I think that's a fair assessment. Things change quite a bit, and it varies between woman to woman. But emotions can range from just being fairly low-key to feeling a little bit nervous or scared, mixed in with excitement at the same time at the prospect of having a new baby.
So a lot of emotions, a lot of things happening there. And as far as the actual baby, is it a fetus at this point? Technically,
yes.
Because now it's embryo and then fetus. So we're at a fetus stage here?
Yeah. Once you get past the first trimester and shortly before that, it truly becomes a fetus at that point in time all the way through to the end.
And I think we have a picture. Do we have a picture of what the actual fetus looks like in the second trimester? There it is. So it's amazing to me how much development has happened here.
Yes.
So you said all the major organs are formed here?
Most of them have. There's some maturation of the nervous system and some other things, but most of the organ systems have formed and now they're just growing and getting bigger.
Such a miracle. Okay, let's talk third trimester. Man, now you're finally over the hump, and you're, going to be only 3 more months, and you're going to have that baby in your arms. What's happening here?
Well, usually, the different changes then start to become more noticeable to the patient. So it becomes more uncomfortable. Sometimes it's harder to sleep. You're feeling the baby move around quite a bit at this point in time. You may notice a little bit of changes in terms of discharge. That's very normal. And then you start to wonder if you're starting to have regular contractions as you get closer towards the end of the 3rd trimester.
I have a question for you. I'd never known about Braxton Hicks, which they're kind of fake contractions.
Yeah.
What are those, and when can women start having them? Because a lot of women think that they're going into labor, correct?
Yes, they're very common, and it's sort of the uterus's way of, reacting to the changes that are going on. The uterus basically is a large muscle that just so happens to have a pregnancy inside of it now, so it doesn't take much to make it want to contract. But the Braxton Hicks contractions are generally the ones that are irregular. They're not too painful. They are noticeable and they can be uncomfortable, but compared to real labor, they're not quite the same thing.
There is no comparison, let's be honest. You think you know, but until you experience it.
Right.
Well, and then at that point, of course, you have the baby after 40 weeks.
Right.
And that's when you come in and decide what's the best, way to deliver.
Right. Right.
Well, if you would like to go and see Dr. Adams or one of the other wonderful, incredible physicians over at the Institute for Women's Health, they're on Floyd Curl Drive. There's their phone number, 614-1000. For more info, ifwh.org. Thank you so very much.
Well, thank you very much.
I wanted to get to some of our viewer questions, but you're just so interesting. We didn't quite do that. So maybe you and I can talk about that, and I can answer some of those for you.
Okay.